we are on the second day of the 35th Congress of the European Society of Medical Oncology in Milan. The amount of attendees has by far exceeded the estimated number anticipated. The scientific presentations are of the highest standard, and already a number of important announcements have been made public. Today we will see the ESMO Clinical Practice Guidelines introduced, as well as the final in the series of patient seminars, which is focused on long-term rehabilitation. This evening there is the long-awaited and prestigious ESMO Benefit Foundation concert, which will take place at La Scala. It will be performed by one of the world's greatest tenors, Maestro José Carreras. We will now see some of the highlights of today's presentations.
Very exciting Congress. We're very proud of it. We were proud all the time of the ESMO meetings with a tremendously good concept of education. And now we were successful in getting the best of science in. We will have practice-changing abstracts in prostate cancer, in ovarian cancer, in lung cancer, and in breast cancer, which will raise a lot of excitement among our community. We had 1,700 abstracts submitted this year, which is 67% over the previous meetings. And among these abstracts, we chose 57% for presentations. We had 200% increase in late-breaking abstracts, which usually, not always, but usually are the exciting data. And 27 late-breaking abstracts will be presented at this meeting. The major abstract will be presented, the new things at the presidential session, at the late-breaking session, but also in the proffer paper session in certain diseases.
Yeah, I was asked to have some comments on the very important work on the FFCD 9901 trial. It was a trial investigating, and it was the first trial to investigate the preoperative radiochemotherapy in early esophageal cancer. Most of the patients had stage 1 and stage 2 squamous cell carcinoma, and the trial compared preoperative radiochemotherapy versus surgery alone. And what came out was that the treatment, and the multimodal treatment, was not better than the surgery alone. This is really remarkable, but it's not so astonishing, because what we know from earlier trials is that patients with more large tumors and those patients with adenocarcinomas may take more benefit from these preoperative treatment than patients with squamous cell carcinomas and with smaller tumors. So unfortunately, this trial give us doesn't give a new standard treatment in oncology, but it tells us that we can do surgery alone, at least for these small squamous cell carcinomas. What the trial does not tell us is if we could do also chemoradiation without surgery in these patients, and this would be a nice issue for a new trial, but I think this will be hard to do because these are really rare tumors, and probably we will stick on the surgery alone. Thank you.
So we've heard today a presentation by Dr. Long and her collaborators, and it was about the results of a phase 1-2 trial with GSK 2118436, which is a very new anti-BRAF targeted agents on patients with brain metastases from melanoma. So this is a very critical situation. Right now we don't have any systemic treatment efficient on this population of patients. So This small cohort of patients, she presented a cohort of 10 patients who received the dose of 150 milligrams of this drug twice a day. So the patient had metastases, asymptomatic metastases, and the largest size of the metastases were 15 millimeter. And the results are absolutely astonishing because all the patients had the disease controlled in the brain, meaning that all of them at least had stabilized disease, but 8 of these 10 patients had a response, objective response in the brain according to RECIST criteria. And parallelly, the extracranial metastases were also responding in a similar way. So it is an extremely good result. Of course, it's a small cohort of patients. It's quite selected patients because it was small metastases, asymptomatic, not edema, not a lot of edema around the metastases, but still it's extremely encouraging. And the burning question, of course, is to know how long the response will last, because we are still too early to say if it will really result in an increase of the overall survival, because we have very few patients that are having the treatment for more than 20 weeks right now. But still, it's a very, very hopeful result.
Thanks to the new therapies, more cancer patients are cured and more are living with cancer. The quality of life is therefore a major point. To get a better quality of life, rehabilitation needs to be part of the treatment. The resolution at the European Parliament is suggesting to European governments to have rehabilitation for cancer patients. The advocacy groups are working to share and implement best practice at the European level. And we thank ESMO because the collaboration with the medical oncologists is a major point to achieve a good rehabilitation.